This is your CT Style Express report, and I'm Teresa Dufour. As we wrap up Breast Cancer Awareness Month, a reminder that screenings can save your life. Middlesex Health radiologist Dr. Sarah O'Connell is here via Zoom. Nice to meet you, doctor.
Likewise, thank you so much for having me today.
So we're wrapping up Breast Cancer Awareness Month. Reiterate to our viewers how important it is to get screened.
Well, breast cancer is the most common type of cancer among women in the United States. And we know from extensive data that mammography or getting a regular screening mammogram is one of the best ways to prevent the loss of life from breast cancer. Oftentimes, there's no signs of a woman having breast cancer until it's a little more advanced and a mass is actually felt in the breast. And with screening mammography, we can detect it when it's smaller and potentially more curable.
Sure. And what are the options when it comes to screenings?
We do screening mammograms in all women, and what's recommended is beginning at the age of 40. If a woman has dense breasts, then we also supplement screening with screening breast ultrasound, which can help us find a few additional cancers that the mammogram may not detect. If a woman is considered at increased risk for breast cancer, either because of a very strong family history or perhaps a genetic mutation, then it might be recommended that she undergo additional screening with a breast MRI.
And what would you say to a patient that says a mammogram is just too uncomfortable?
Well, I'd say that, it can be somewhat uncomfortable for some women, but usually it's not as bad as they fear. And it's just a few minutes, and it's certainly the best way that we have to detect early breast cancer and potentially cure it.
Sure. And how common is it? I know if you have a family history, you might be more at risk, but what are the statistics that you see?
Well, so the average risk woman has a lifetime risk so 1 in 8 women will develop breast cancer over the course of their lifetime, and that's for women of average risk. Mm-hmm. We know that in about 1 in 6 breast cancers will occur in women aged 40 to 49. So even younger women in their 40s, still benefit from regular screening mammography.
And Dr. O'Connell, you mentioned there are very few signs, early detection signs of breast cancer, but what should you be on the lookout for?
Well, certainly if there are changes to your breast, so if you feel a lump, if there's a change to your nipple, skin dimpling, redness, thickening of the skin, these are all signs that may suggest that there is a breast cancer.
Got it. And you said probably right around 40. If you don't have any of those family risks, would be a good time to start getting mammograms. And where are your imaging centers located?
Well, Middlesex Health has several imaging centers that perform the full gamut of breast imaging. We have the outpatient center here in Middletown. We perform screening exams at the center on the Shoreline and also in the Marlborough Medical Center in Marlborough, Connecticut.
Great. And just one last time, how important it is to get those screenings. Really, there's nothing to be afraid of. It's something that should be part of your routine.
Absolutely. Just like any preventative health test that we undertake, regular doctor visits, a screening mammogram should be part of our regular medical routine. And, I think with time that the fear and the discomfort certainly lessens too.
Sure. Absolutely. Doctor, thank you so much for the information. You can learn more over at middlesexhealth.org. We appreciate your time.
Thank you so much for having me.